And we are rolling. Off to you, Dr. Johnson.
Hello, everybody. Welcome to our webinar for CLARiTI today. I'm Sterling Johnson, one of the PIs for CLARiTI. I'm joined today by Beth Mormino, one of the other co-PIs here. And today our topic is return of results. And Annalise Rahman-Filipiak and Lindsay Clark will be presenting to us today. Before we get into that, we'll have some study updates for you all. At the top of the webinar today, I just want to also say how that CLARiTI is our overall approach, our strategy, our recruiting plan is going to stay the same. Nothing is changing for us. We're excited for the support we have from NIH and for the opportunities ahead of us to begin the recruitment phase of this study. So I'll end there and turn it over to Erin Chen. Welcome, everybody.
Thanks, Sterling. Hello, and welcome to this exciting webinar. So Heather O'Connell from NAC and I will be sharing some study startup updates. Next slide, please. All right, I'll start with our first announcement. So our Penn site has been activated. So welcome to Dr. David Wolk and the team at UPenn. Next slide, please. Okay, this just shows a graph of our site activation and initiation visits. So we do have 2 sites activated. We've got many more site initiation visits completed with many more scheduled. And we just have one site that is still in progress. So we're well on our way to getting all of our sites activated. Next slide, please. Here is a chart of participant procedures that have been completed. I'm not going to go over this in too much detail, so please feel free to refer to it. We do have 10 participants enrolled at Wisconsin, and as of yesterday, we have our first participant at the Penn ADRC, so that's really exciting. They have more that are scheduled for the month of May. Next slide, please. All right, so just a reminder on our site initiation visits with our central monitoring team. We do have 3 additional dates that are available if your site has not yet completed the site initiation visit, or if you need to reschedule. So just reach out to your project coordinator or the regulatory team to get that scheduled. The expectation is that your regulatory binder is complete by the time that you do attend that site initiation visit. So our monitoring team can audit that binder. Next slide, please. All right, I'll pass it over to Heather for a subaward update.
Hi, everyone. I'm excited to pop on today and share the exciting progress and momentum with the CLARiTI Subaward. So since the last time we gathered in this fashion, all sites have completed their documentation, as well as all sites have then had their subaward issued from University of Washington OSP to your site's local grants and finance team. So all 33 have been issued, very exciting. And some even partially executed, and we're up to 4 fully executed subawards. So very exciting, lots of momentum. Yeah, just have your grants teams work with University of Washington to get those all to fully executed. So very exciting. I'll pass it back to Erin.
All right, next slide. Okay, just a reminder for our CLARiTI Investigators meeting. This is the Wednesday following the ADRC spring meeting in San Francisco. So that will begin, breakfast will start at 7:45. The meeting itself will begin at 8:30, ending at 11:30. So we will hear updates from each of our cores. We'll have time for Q&A and then time for discussion and our networking. So just a reminder that in-person registration has closed, but the option for virtual attendance is open to all, and we hope you are able to join us. All right, I'm going to pass it off to Dr. Johnson.
Yeah, and I just want to second that. We welcome you to attend that investigators meeting. We'll be talking about our vision for the next year, what we plan to accomplish, and want to get your input as well on how the study's going for you and any barriers you're experiencing at your site. So on the next slide, I wanted to announce the a TDP 43 summit that's going to happen June 12th. This will be, there's a in-person component to this that's filled up, but there's also a remote option. And we would just encourage you to attend if this is of interest to you, to learn about the latest in TDP-43 biomarkers, what's working, what's not working, what are the lessons from prior experience, and what are the opportunities ahead. We're going to have experts from across the country and some from Europe who will be joining us, and we look forward to that event. There'll be these links are going to be put into the chat. Feel free to investigate those to see what the agenda is, and if that's of interest, feel free to RSVP. Okay, we are now turning to the main event, the return of results. And I want to thank my colleagues, Annalise Rahman-Filipiak and Lindsay Clark, for the work that they have done and their team on the return of results toolkit. And so let me turn it over to Annalise and Lindsay.
Thanks so much, Sterling. And thanks everyone for being here. We know your time is so valuable, and we are just really excited to share the work that our core has been doing over the course of the past year. We'll start with just a little bit of background on the importance of returning results in the current context. I'll talk a bit about our CLARiTI flexible return of results protocol, so walk through it. Then I'm going to pass it off to Lindsay, who's going to take a bit of a deep dive into the toolkit itself, show you some of the materials and resources we've provided. And then finally, we'll talk about future directions and the timeline for rolling this out. Next slide, please. So to provide a little bit of background on return of research results, next slide. Before we jump in, I wanted to mention that while Lindsay and I are the ones presenting today, we really have a fantastic team as part of the return of results core. So many of them are on the call with us. While we do ask that you hold questions till the end, we know that you may have questions that come up, and feel free to put them in the chat. Several of the folks from the Return of Results core are in attendance and will be responding to those questions via chat during our talk as well. But again, thanks so much to this team. Click for me. I do want to mention we have a new member of our team, Claire Erickson, who's at Banner, has joined us. She has amazing expertise in returning results for some of the large studies, so we are very excited to have her skill set join us. Next slide. The reason we felt it was important to start with the background is to provide some context for why we think our approach is important, and just taking a thoughtful approach to returning individual research results to participants is so critical. There are some known risks associated with learning a biomarker result. However, the majority of studies at this stage show that psychological risks of returning results are fairly minimal. At least in the studies that have been conducted in largely homogeneous, psychiatrically healthy folks, we know that learning an elevated amyloid or even amyloid and tau result may result in some mild increases in test-specific distress, so distress around learning your result, but we don't tend to see significant exacerbations or new onset of psychiatric symptoms. We also are not seeing evidence of suicidality. The caveat to this is that, as I said, the majority of these studies have included samples who have no known mental health history. And of course, when we think about rolling out biomarker disclosure on a much broader scale in specialty care or primary care eventually, we need to know more about how a more psychiatrically heterogeneous population would respond. CLARiTI is a fantastic opportunity for us to understand post-disclosure outcomes on a much broader level. And so while you'll see that we incorporate psychological disclosure or psychological outcome measurement both before and after disclosure as part of our toolkit, we have a range of ideas of ways we can do this better. And so if you're interested in this idea of post-disclosure reactions, please let us know. We're hoping to launch some more nuanced investigations of other psychological constructs, as well as effects on care partners and family members. Next slide. There are also psychosocial or legal risks associated with learning a result, particularly if that result goes beyond the participant to the medical record or the clinical team, or even to loved ones in the person's life. If an elevated result is shared with others, the participant can experience stigma, being treated differently by those around them, or medical, legal, and employment discrimination. At this stage, the evidence around how often this actually happens is very limited. We have anecdotal evidence, but there are several of us who are working closely with the Alzheimer's Association and other organizations to try and take a systematic approach to measuring this. What this does require is thoughtful data sharing procedures and careful pre-disclosure education to participants and family members as they make the decision about learning their results. And you'll see that's incorporated in the toolkit. Next slide. While this seems to be, a more challenging topic to cover in the current climate, we are very committed to not taking a one-size-fits-all approach to returning results and really incorporating cultural sensitivity. There are also important cultural considerations for returning results. While we know that the prevalence of Alzheimer's disease is much higher in individuals from minoritized racial ethnic groups, the actual performance of different biomarkers varies by these groups based on a range of different factors that we don't have time to go into today. We also need to remember that the risks and benefits that I just talked about of learning a result vary significantly by the individual participant's social and cultural context. So for instance, an early diagnosis and on-ramp into treatment and care could be more influential for individuals who historically get diagnoses later or less accurately. On the other hand, the risks associated with learning a biomarker result, distress, stigma, discrimination, are things that are already affecting disproportionately individuals from minoritized groups. We also need to consider that the way in which we share this information is likely not supposed to be the same across all populations and cultural groups. We're excited to work with the Access Corps from CLARiTI, as well as the pilot sites. Many of you we know are experts in working with populations across our nation, and we really want to partner with you as we roll out this process to understand how we should adapt it for different populations. Next slide. So why are we so committed to this? Why was this built into really the infrastructure of CLARiTI? It's because we know that participants want their results. It's an important tool for recruitment and retention, as well as just building trust with participants. We hope that CLARiTI will recruit a very representative sample. And with that in mind, we think it's important to offer as much transparency around individual results as possible. We also know from studies like IDEAS and others that enhancing or sharing results can enhance diagnostic confidence among clinicians and can inform personalized treatment approaches, access to clinical care, research, other clinical trials, etc. And finally, even outside of the clinical and research space, we know that participants tend to leverage this information for their personal health decisions, whether that's engaging in diet and lifestyle changes, engaging in advanced planning that's informed in part by the biomarker result, or even caregivers preparing for their roles or potential roles in the future. So we do feel like returning results is incredibly important, and we are so excited to be able to share our expertise in this area. Next slide. So as we started developing our thoughts on how a protocol should be formed, we wanted to start with a needs assessment. So again, I want to thank every site on the call who responded to another questionnaire last year. So around this time last year, we sent out a survey through NAC to better understand what sites were currently disclosing to participants, under what conditions, who was conducting those visits, what those visits looked like. And that really has helped us inform our current protocol. I'm not going to go through what we've learned in detail, but I do want to highlight that at least at this stage, approximately half of the sites are disclosing amyloid PET results to their participants. Of course, they're disclosing a lot of other information, and our goal down the line, as you'll hear from Lindsay, is to develop return of results procedures for other types of biomarker or health information, as well as eventually a more integrated disclosure visit. But given that amyloid PET disclosure is kind of our first target, this is where we focused in the return of results toolkit as we've currently developed it. Next slide, please. So now I'm going to pivot to talk about what our protocol looks like currently. Next slide. I want to start by mentioning that we learned from that survey that there are many different site-specific approaches to returning results. We learned from many of you who have very well-established and empirically based approaches to returning amyloid PET. So we are not forcing any site to use our methods. We do ask that now, as you're thinking about not only rolling out the scans themselves, but the disclosure process, that you start to discuss as a site, if you have not already, if you will be disclosing amyloid PET results, to whom, so to all participants or to participants who meet certain conditions, and then what those conditions might be. Additionally, it's essential that you start thinking about what the return of results roles look like at your individual site. Who completes the scheduling, the screening, the more administrative aspects of scheduling your return of results visits, who should be alerted when the visual read report is available and who should have access to that report on your team, and finally, who will be returning results. As I mentioned, our protocol is designed to be a flexible set of recommendations and materials. We hope that there will be sufficient information in there for sites who are not currently disclosing any information to build a process and to use our resources. However, out of respect for the fact that many sites have these very well-established and successful protocols, we're not mandating that you use those. What I do want to mention is that if you do decide to use our CLARiTI Return of Results Toolkit, know that the materials therein, particularly the participant-facing materials, have already been approved by the CLARiTI WCG IRB. If you modify these materials significantly, that does require approval from the WCG IRB. That doesn't count things like adding your logo or updating the study coordinator or contact information, but rather larger changes to the materials we've provided. And if you use your site-specific process or materials, that would require approval, likely by your site's local IRB. But if you have questions about any of this regulatory approval stuff, please reach out to Erin. She is our resident expert and will happily chat with you about what that might look like. Next slide. So we wanted to start with just a bird's eye view of what this process will look like. So what the steps might be in the general timeline. So there is the informed consent step, during which you'll also provide the participant with an educational brochure, the PET scan. We believe that visual reads will take around 90 days to complete or will be completed within 90 days. And that's the point at which you'll really launch the return of results protocol. There are several pre-return of results visit steps that you'll take, which I'll talk about in a minute. You'll then complete the return of results visit. And finally, there's an optional telephone follow-up element. I'm going to take a bit of time to talk about each of these steps. And then, as I mentioned, Lindsay will walk through the materials associated with each step. Next slide. So first, as a reminder, there are two versions of the return of results consent. As I just mentioned, it's not required, or excuse me, the CLARiTI consent. As I mentioned, it is not required for sites to disclose amyloid PET results to all participants, and so we have two versions. The first version is the CLARiTI consent with return of results. This includes a section that discusses the risks and benefits associated with learning one's biomarker result. However, if you decide that there are participants to whom you will not be disclosing or are not eligible for learning their results, you'll use the general CLARiTI consent. At the time that you're consenting participants to the study, you will provide a copy of our educational brochure. This is titled the Brain Amyloid Imaging PET Scan, Should I Learn My Results brochure. Again, this is something Lindsay will discuss a little later. I do want to mention that we have worked hard on this. However, we expect that it will change over time as we get feedback from you or as we integrate new data. With that said, we wanted to provide you with some hard copies that are professionally printed. And so those should be coming to your site any day now. We have shipped them out already. Next slide. There are some tasks that are important to complete prior to the return of results visit. This can occur anytime between consenting and scheduling the return of results session, and it will involve completion of our electronic case report form for the pre-return of result visit. Now, ideally, from our perspective, it's best that these steps occur after the visual read has been completed, in part because there are certainly cases where the visual read is incomplete or cannot be completed because of a data integrity issue or some other issue. So we don't want you to offer and schedule and set up appointments with a participant without knowing that those results are already available. However, we recognize everyone's workflows are different, so certainly this can occur at the same time of consent if that's best for your site. During the pre-return of result visit, I say that loosely because it can occur by a phone call or other method. Whoever conducts that visit, likely a study coordinator, will review the educational brochure with the participant. By this, we just mean ask if they have had a chance to review the brochure, if they have any remaining questions that would influence their decision to learn their results or not. You'll then record whether the participant opts in or out of learning their results. There is an option for unsure, so the participant, if they need more time, they can take that. And then you also record their motivations for learning their result or not. If the participant elects to opt in to learning their results, you'll schedule the return of result visit. And it is, we have a growing amount of data to show that virtual visits are A-okay. So we recommend that a virtual visit is, certainly fine and can potentially reduce burden for sites. You find the pre-ROR ECRF, sorry, that's a lot of acronyms there, but you find this documentation in the electronic data capture. I've highlighted it below. And if we go to the next slide, you'll see just a copy of what that looks like. So essentially, you'll fill out the questions, as part of the ECRF. The questions populate based on the participant's answer. So if they say, I'm opting in, it provides a list of possible motivations for wanting results, and you'll fill that in with the participant. Next slide. As I mentioned, we've tried to develop a protocol that reduces burdens to sites, knowing that that was a concern for many folks when they completed the needs assessment. However, as I mentioned at the very top of this presentation, we do think that some level of psychological pre-screening is important to determine the appropriateness of disclosure for each individual participant at that time. There are a range of ways in which this psychological pre-screening can occur. We have provided and IRB approved several CLARiTI versions of common symptom inventories or clinical screening measures that have been used across other return of results studies. Those include things like the patient health questionnaire, 8 or 9 item, and the GAD-7. We have also provided alternative screening options. You can opt in to include as many of these as you would like. Really, it's going to be based on your site's judgment. You may already know quite a bit about your participants, and therefore psychological screening is less important. While we have provided cutoffs for each of these based on, again, the empirical literature, we want to emphasize that clinician judgment and site judgment is incredibly important here. So certainly you can experience a participant who doesn't achieve any elevated scores on these clinical measures, but is otherwise indicating that they are likely to experience a high level of distress or that they're really unsure about learning their result. We encourage you to rely on your clinical judgment. As I mentioned, this decision to integrate mental health screening is site-specific, but we do recommend that every site, of course, has a safety protocol. So for instance, if these psychological screens are completed by a study coordinator prior to the return of results visit scheduling, and there's an elevated score, it's important that you have a pathway for that study coordinator to reach out to a clinician to complete some level of risk assessment or follow-up. You may already have the safety protocols at your site. Again, any sites that are using materials that are not part of the toolkit would need some level of prior approval from either your local IRB or the WCG IRB. Again, please refer these questions to Erin. Next slide. This is just a slide to talk about the potential steps of preparing for your return of results visit. It is required that you review and download the return of results summary sheet from the ADRC portal dashboard. We'll talk about that a bit later. We also recommend that you may consider reviewing additional participant information that would likely be critical context for returning the results. This might include things like cognitive test performance or research diagnosis from prior longitudinal study visits, medical history, etc. We also recommend that you prepare additional educational, community, or support resources that are site-specific. So while we do have some educational resources that we include in the toolkit, you likely each as sites have materials that you have developed to support the sample and the geographic area around your site. Next slide. So how do you access the PET results summary report, and when do you know it's ready? So we have developed a mechanism alongside NAC for an email to go out to sites once a participant-specific visual read is available. So you can click for me. It'll look something like this. This is just a draft version, but essentially the folks that you have designated at your site to be alerted will receive this email indicating that the visual read has been completed and the result report summary is available. The report can then be accessed through the EDC. So if you want to click again, so there is a tab under the EDC where that is accessible, and then click again. That will populate, this field through which you can download the amyloid summary report. The way the actual report itself is something that Lindsay is going to talk about a little later. Next slide, please. So how do you go about conducting the return of result visit? So this is largely going to be conducted by a clinician or an advanced trainee under clinical supervision. Again, this is a site-specific decision. What is required would be the steps of sharing the result, discussing the meaning of that result in the participant's context, as well as some recommendations and resources. And then finally, following the return of result visit, completion of the electronic case report form for the return of result visit. We recognize that, again, that many sites have a procedure for doing this. Many of you are clinicians who do this regularly in your practice, and so we are not dictating what this has to look like. However, we also know that there are sites that will be doing this for the first time. And so we have developed a training manual, scripts, and various other materials to help assist with this, as well as a recommended but optional set of steps. Those include, again, reviewing that educational brochure, answering any remaining questions that could influence the participant's decision to receive their results, reviewing relevant contextual information, confirming the participant's interest in learning their results, walking through that summary sheet and the meaning of the result, using a teach-back method to assess understanding from the participant, clarifying any points of miscommunication and answering questions, and then providing those recommendations and resources, as well as assessing any participant immediate responses to the information. Again, following the visit, you can complete the return of results visit ECRF. Next slide. So again, the ECRF can be found in that same electronic data capture platform. And the ECRF does contain, mostly feasibility information. So we want to know who at your site is returning this information, the format, the length of the visit. There is also space there for some additional fields and information. Next slide. Again, in an effort to reduce burden to sites and not interfere with existing protocols, we do not require follow-up. However, we do strongly recommend that sites have a mechanism to follow up with participants, particularly participants who receive elevated amyloid results and or express some level of distress before, during, or after. So again, there will be some clinician judgment involved here, and important that team members on the return of results team at each site communicate about any concerns they might have. We recommend that this happens, again, to limit burden to both the participant and to the sites via telephone or virtual visit. This can occur 1 to 3 weeks following the return of result visit. This gives the participant sufficient time to be able to process their result and generate additional questions. However, of course, if you notice that a participant is more distressed, you can be more conservative and follow up sooner. During this visit follow-up, if you elect to complete it, we recommend you repeating the psychological screens that were conducted prior to the return of result visit, and then potentially administering some extra screening measures, including a measure of test-related distress, evaluating additional resource needs or recommendations, and we have also included a 10-item satisfaction questionnaire. We recognize this is one more thing to ask you and participants to do, but this would be hugely useful to us as a core as we begin to roll out and evaluate the effectiveness of this protocol. If you elect to complete a return of result visit follow-up, then you would also complete the associated ECRF form. We click on the next slide and see a copy of that form. So again, all of the information from the prior slide would be captured in this form. You can select any measures that you have completed and would fill them in as appropriate. Okay, next slide. So again, just going back to our global timeline, we hope that this protocol has allows for sufficient flexibility at the site level, but also for sites who are looking to build a return of results program from scratch. We really hope that this protocol, along with the toolkit resources, allow you to do so in a supported way. I'm now going to pass things off to Lindsay, who is going to give you a tour of the toolkit. Thanks.
Thanks, Annalise, and thanks everyone for your attention today and being here. So you can go to the next slide. So the toolkit materials will be located on the CLARiTI website and accessible through the toolkits and resources section of the website. You can go to the next slide. So I'll walk through some of the different materials that Annalise mentioned earlier. So the first folder you'll see in the toolkit is called Training Resources. In here, you'll find a training manual, which describes the protocol that was covered earlier in a little bit more detail, and also provides background on research and recommended procedures in disclosing biomarker test results, some of the ethical considerations, issues related to interpretation of biomarker results, the kind of language we might use when sharing back results with research participants, and some other considerations, including some frequently asked questions and some potential responses. In this training folder, we also have developed a set of case vignettes, and these just describe what the conversation can look like between the study clinician who is providing that research biomarker result and the research participant. We have a few different cases. One is a cognitively unimpaired person who's learning an elevated amyloid result. Another one is similar, but is also shows what it might look like if the person is endorsing some symptoms of depression or anxiety related to learning that result. And then we also have a vignette of a person from an underrepresented group who has some cognitive symptoms and medical comorbidities and is learning a not elevated amyloid PET result. So these aren't like hard, fast ways you have to talk through these return of results with participants, but more just to give some examples of what this can look like, especially for individuals who maybe haven't had these conversations before. All right, next slide. The educational brochure was mentioned earlier. This is provided to participants at the time of consent, and this is just a resource for them to get some more information about what is amyloid, what is an amyloid PET scan, what are those possible results they could learn, and what are some things they can think about when they're trying to decide whether or not they want to learn their research amyloid PET result. So this can be provided to participants. They can review this on their own, and this can also be kind of a guide for study teams to use to actually talk through some of this information with participants at the consent or later on during that beginning of return of results visit. And next slide. The toolkit also includes a library of psychological screening and impact tools. The depression and anxiety screens here include the patient health questionnaire 4 and 9 item version, the generalized anxiety scale 7 item version, the GDS short form, and the Columbia suicidality screener. These are available. They're IRB approved within CLARiTI, and so we recommend using one of the tools here. If you are interested in utilizing this procedure either before or after the return of results visit. The test-related distress measure that we include is the impact of genetic testing or neuroimaging in Alzheimer's disease scale. This is a 16-item scale that's really targeted to measure some distress related to learning about risk or biomarker results of Alzheimer's disease. And then we also include a satisfaction and utility questionnaire, again, to help us better understand how participants are receiving these results, whether these are useful for them to receive, and whether they have any feedback on what we can do to improve the process. Yeah, so I think that's it for those tools. And again, in the protocol, these are recommended, but an optional component of the process. Next slide, please. This is a draft of the amyloid PET summary report. So in the toolkit, you'll find a template version of this, but as Annalise mentioned, when these are generated for individual participants, you will receive an email that they're ready, and you can download that individual result to provide to a participant. The purpose of these is to use them to review the meaning of the result and for participants to have something that they can take home with them at that return of results visit. It includes a verbal description of what the result means, as well as a picture of their amyloid PET scan results above the reference scans of what a not elevated or elevated amyloid PET scan looks like. And then on the last page, there's a glossary that includes just a description of terms that are used in this report. Next slide, please. And on this report, here kind of just zooming in on what this text looks like. So if a person's amyloid PET scan is read as not elevated on the left, that checkbox on the front page of the report would be checked to say not elevated, and the following text here would appear. It would say the scan did not detect amyloid plaques in the brain. You would let the person know that this result can have different implications for different people. Please talk with your research team about what this result might mean for you. So if the person has cognitive impairment, this result means that Alzheimer's disease may not be the primary cause of their memory or thinking problems. And instead, there may be other causes of the memory or thinking changes they're experiencing. For individuals who are not experiencing memory or thinking changes, this result suggests that there's not an increased risk for developing Alzheimer's dementia at this time. There also includes a couple of caveats here that the result only shows amyloid levels at the time the test was done, so it can't predict the future. A person can still develop amyloid plaques or Alzheimer's dementia in the future. And the scan does not measure other brain diseases like cerebrovascular disease, Parkinson's or Lewy body disease, or frontal temporal degeneration. On the right side of the screen, this is what would generate if the amyloid PET scan is read as elevated. Again, that elevated checkbox would be marked, and the text here would appear on the report. It would say the amyloid plaques were detected in the brain. Amyloid plaques are one of 2 key brain changes that occur in Alzheimer's disease. Again, it notes that this result can be different for different people. So for individuals with cognitive impairment, the person's memory or thinking problems may be at least partially caused by Alzheimer's disease. For individuals not experiencing memory or thinking changes, there is an increased risk of developing Alzheimer's dementia in the future. It's not possible to provide exact risk information based on this elevated amyloid result. And again, it notes that the scan cannot measure those other brain diseases. Okay, next slide, please. Another folder in the toolkit houses some participant education and support resources that may be useful to have on hand to provide to participants as part of their return of results visit. So one folder includes a handful of pamphlets or brochures about Alzheimer's disease or other forms of dementia. Another folder includes some brochures and guides on advanced planning or thinking about next steps when receiving a diagnosis of Alzheimer's disease. Another folder is focused more on dementia risk reduction or brain health pamphlets and brochures that can be useful, especially when talking with a person who's cognitively unimpaired or has mild cognitive impairment. And then the last folder is an example of local community resources that we use in Wisconsin or Annalise uses in Michigan. So these are less useful for you if you're not in our area, but are really meant to serve as examples of what could be helpful to have on hand for your participants, like lists of memory clinics in the area or other kinds of community resources available for individuals with memory loss, or other things like mental health resources, transportation resources, those kinds of things that you might already have available at your ADRC for participants, but just kind of thinking about having those available for these particular visits is helpful. All right, next slide. And then the last folder is really just some example materials and resources that were graciously shared with us from some of the sites in the ADRC network who are already disclosing amyloid PET results or other test results with their participants. So these include some additional informational or educational decision guides for participants about amyloid PET and other test results. These also include some example reports that sites use that provide feedback not only on an amyloid PET result, but also some other ancillary information that's collected as part of the ADRC visits, like cognitive diagnosis, cognitive test results, labs, or other kinds of like brain health related information that's collected. And then we also have an example of a semi-structured interview that provides a more kind of structured or scripted approach to conducting a return of results visit. These resources are just kind of educational and informational for sites to use if they're thinking about developing their own return of results process and they want to expand beyond what we have in the CLARiTI Toolkit. So if you want to use these or kind of adapt these for your sites, please ensure that you do submit those to the CLARiTI WCG IRB or your institutional IRB if this is something you're thinking more broadly for your ADRC clinical core, for example. And next slide. All right, and I have just a few FAQs to wrap this part up with. So one question that we have heard is, do we have to disclose amyloid PET results to CLARiTI participants? And the answer is no. Again, there's 2 different consent forms. So you can use the CLARiTI consent form for your site that does not include return of results if you prefer not to include return of results as part of your process. Next, please. If we disclose CLARiTI amyloid PET results, do we have to use the toolkit? So again, we did try to develop this to be pretty flexible so that there is a lot of room for sites to develop their own processes or do their own procedures if they already are doing something. But there are a couple things that are required. So the educational brochure that's CLARiTI approved is required to be provided to participants, and the PET summary report that's generated after the visual read is also required to be provided to participants. One thing I think I forgot to mention earlier is that that report does include both a verbal description of the result and a visual image, and sites do have the option to provide the whole report to participants or just provide that verbal front page if that's preferable. Please also use, if you are going to administer a psychological screener, please use the CLARiTI approved psychological screening measures. And then the resource packet is publicly available materials. So that's doesn't need to be IRB approved, and those are of course optional for sites. This has already been mentioned, but just to kind of reiterate, if you want to adapt the materials for your site or include additional materials, that's fine, but please plan to submit those to the WCG IRB for approval, unless it's already approved by another protocol. And if you're not sure, just reach out to us and we can help kind of navigate that with you. Why are there only amyloid PET materials? So this is the first available result for sites to provide to participants. So we wanted to get this out with these results with just the amyloid PET results. But once tau PET reads are available, we will adapt the materials to include both amyloid and tau PET result information. So we do plan to do that in the future. And we have these examples of reports from other sites that include some additional information like cognitive performance diagnosis in the toolkit. And we hope as we go forward to continue to develop some additional kind of more integrated CLARiTI tools that include some additional information from ADRC visits as well as the biomarker test results. And is this the final version of the toolkit? So this is going to be an evolving toolkit. The current version will always be available in the CLARiTI Toolkit link. We are going to update and add new materials as we gather feedback from our participants and from the sites, and as additional biomarker results are validated. If we are making changes to the toolkit, we will communicate that to CLARiTI team so that you'll have a heads up on that. And next slide, please. So I'll wrap up here by talking a little bit about timeline and future directions for the return of results core. Next slide. In the gray boxes, there are things that we have already completed. So Annalise already mentioned this survey that we did with you all last year, and that is currently under review for publication so that that can be available for the ADRC community to see kind of where things stand at this point. We developed a return of results protocol, gathered feedback and materials from pilot sites. So thanks to the pilot sites for helping us out with trying to make it better. And we also gathered information from sites that are already doing this really well. to see what we could kind of again improve. And so here we are with the first version of the return of results toolkit, which we'll be disseminating through NAC. And then the next step is that after the PET scans really get going, then the amyloid PET results will be available to sites. And the goal for that is to happen sometime this summer. And then our team will be available to provide individual consultation to sites on implementation of the return of results protocol and the toolkit. And we also hope to develop additional training resources as well as some additional workshops over the next year to kind of dig in a little bit deeper on particular aspects of this protocol and on things like providing these results to our research participants. And then finally, as noted, we'll update the toolkit to include those tau PET result materials as well. If you have any questions for us, we'll be here today to do a little bit of Q&A, but please don't hesitate to reach out to our team. The best contact person for us is our return of results coordinator extraordinaire, Haley Cole, and her contact information is here. You can also reach us on the ADRC program community forum. Just tag your question as Clarity Reads or Clarity Roar so we can see it. And as noted, if you would like to set up an individual consultation with our team, we are available. So please just contact Haley and she can get that scheduled with us. Thank you so much for, again, being here. And I am happy to, we'll be here to take kind of some initial questions.
Wow, that was great. Thanks, Lindsay and Annalise. So we have a little over 10 minutes for questions. There's a couple in the chat that we can start with. So maybe I'll start with one that actually was in the chat and not the Q&A, so I don't lose it. So there's a question about specific training for those disclosing results for CLARiTI. So you guys did mention resources and training, but is there actual like required training for the sites to be able to do this?
Yeah, I can take that one. There's not a required certification process for this study. We do, again, have the training manual as a resource. So we recommend that anyone who's going to be doing this read through that training manual and attend any kind of training workshops that we put on over the next year. And Annalise, let me know if I'm forgetting anything, but I don't believe we have any specific training requirements.
No, and in part that's because we know that many of the clinicians at sites that will be doing this kind of work have their own style and their own training background to be able to do that. We also wanted to mimic the training sort of process that occurs at several of the other large studies. And so we don't require like a formal certification, but we do want to hear from you about training needs. So, you know, as Lindsay mentioned, this is a living set of materials, and our next set of goals, in addition to addressing things like tau disclosure, will be to develop these training videos that will live in a library. So if you have particular topics that you want to hear about, please let us know.
All right, another question is from Nina. She's asking about the plan regarding brain donation. Are there sample informational materials available for that too? This is important for people in particular that are not cognitively impaired. So this core, the return of results core, is not, you guys are not managing, you know, the topic related to brain donation. So to my knowledge, there isn't anything specific to CLARiTI that's being developed for brain donation. I know there has been some conversation between the Neuropath Core led by Dirk Keen and also Access Core about such material, you know, whether or not that would make sense. But Sterling, do you want to comment on that?
No, just agreeing with you that this is up to each site. They'll be enrolling in their ADRC Neuropath Core brain donation program. So it'll be whatever the site has on hand for those things. But we can try to help move that along and consolidate some materials like Lindsay and Annalise have done for return of results.
I might also mention that at least at Michigan, and I think this is true for Wisconsin and other sites as well, that we find that any touch point of like feedback for participants is a great opportunity to not only provide some general education and support resources and that sort of thing, but also to potentially link participants to other study opportunities, whether that's a more personalized set of studies for which they might be eligible based on their result or history, or whether it's these other opportunities. We, of course, want to recognize this is an incredibly vulnerable and sensitive visit that you're going to be doing with participants, so you don't want to immediately follow it up with a, oh, and also would you consider donating your brain? But what we can do is provide at least some examples of some of the brain donation, videos or materials that we use at our sites that we might, for instance, we share them with participants at the 1 or 6 week follow-up that we do locally. So I do think it's a great point, Nina, to keep the ball rolling with research involvement, particularly given the commitment from CLARiTI to have a really representative sample. So
there's another question in the chat, Annalise, that you actually you addressed, but I think it's worth maybe covering this question. So this is from Alessandra. She's mentioning, that 90 days. So the return of results back to the site, we're planning for a 90-day window that would be initiated the moment that the data is actually uploaded, not necessarily the day that the PET scan happens. But we need to, factor in a delay to account for all the workflows that need to happen on this data. So that's, we're estimating 90 days. Hopefully it'll be lower, but I think that's, what we need to plan on and what needs to be communicated to the sites. So the question is that this may be, somewhat problematic for folks. It may cause them anxiety. Is there any kind of feedback on how to deal with this and to make, participants more comfortable, given this delay period? So Annalise, do you want to take that? You typed up a really nice response.
Sure. I really appreciate this question, Alessandra. I think it highlights how important pre-screening is. Sites are welcome to be more conservative with how they pre-screen participants. I think it's a good point that many participants will be in part enrolling in CLARiTI to receive their results, and to have that opportunity in mind that the wait can be really stressful, not only for participants, but potentially also their family members or others that could be impacted by the results. When we say be more conservative, that could look like incorporating additional formal check-ins. So maybe there's a check-in that happens after the scan is complete, but it could also be informal check-ins. So again, one of the things that we do at Michigan is we have a few phone check-ins that happen, particularly if there is a delay in acquiring the PET scan or acquiring the visual read result. It also really, highlights how important being transparent about this process is at the time of consent. So really letting participants know that when they sign up for this portion, that there is going to be a significant wait. And while we'll try to be not only as efficient as possible, but also as transparent if delays do occur, that's something that they'll have to expect. So this may not be, for instance, if a participant needs a result by a certain date, or they're trying to make a particular decision by a certain date, this may not be the mechanism to receive that result. And so again, if you have if you're working with participants who to have these concerns at baseline, you may potentially have a mechanism built into your site to follow up with them formally or informally.
All right, are there any other questions from the audience? Okay, if not, I want to wrap up by thanking Annalise and Lindsay. I mean, this was a tremendous presentation, but more broadly, I mean, the amount of work you guys have done on this effort is truly impressive, not only for providing these resources and being so thoughtful for thinking about how to implement this. You guys have also gone above and beyond to understand what's actually happening at the sites now, and to work with sites to implement protocols that really could work for the specific needs, across the program. I think these efforts, really, they go beyond CLARiTI. They're going to impact all the ADRCs, all the participants that are undergoing amyloid PET. I also am really excited about how this is going to build a framework for you guys alluded to this, but maybe more complicated disclosure. So Tau PET and this integrative approach that integrates across multiple modalities and clinical data. So yeah, just thank you, a huge thank you for your work on this, and really look forward to seeing where this goes over the next couple of years.
Thanks so much for your support, Sterling and Beth, and everyone else who's been so patient with us, providing information, and really shout out to the team. We have an incredible interdisciplinary multi-site team who've made it a great collaborative effort. Thanks.
Okay, so we'll end there. Thanks again for everybody's attention and participation in the webinar, and we'll see you guys, hopefully most of you in May at the investigator meeting.